Good morning, Dr. Patino here at the Cosmetic Surgical Center of Osarito. So we are doing micro air power assisted liposuction. Can you please show them the color of that output?
Wow, I see yellow.
Yeah, and we're gonna do fat transfer to the buttocks. And this is a tough case because this is a patient that has already had surgery before. And so there's a lot of scar, there's a lot of fibrosis. I was trying to put the anesthetic medication and my infiltration cannula was almost bending over.
Wow.
It was so much scar tissue, so it was going through rocks in here. Unbelievable. But look at that, even in those cases, we're able to get almost pale-like.
It's almost white.
Yeah,
Yeah.
completely bloodless, oilless, aspirate. And it's incredible for her because this is what's gonna go into her buttocks. So it's gonna be, she's gonna be able to retain all of these because it's pure fat, you guys. There's not fat mixed with oil, which can give you an oil cyst, or fat mixed with blood, which can also give you other complications and higher risk of infection, by the way, when you put blood in there. Because when you have a hematoma, for example, which is a collection of blood, guess what? There is a high risk of infection. But this is just incredible here at the Cosmetic Surgical Center of Osarito. We do these pretty much all the time, right? And it's just unbelievable, unbelievable. I am amazed every day. It's like when I go on an airplane, I see the airplane flying, I go, wow. No matter how many times I fly, I still see, how do they do this? Well, it's the same thing here, you guys. This is just incredible, incredible beauty. And I see the image of God here. But it takes the patient's. So look at the color of that aspirate, completely bloodless. There's not even a speck of blood. It's unbelievable. Bloodless and oilless, and that's what's gonna go into her buttocks. It's a special technique, you guys. It's just pretty amazing here. And she looks great. Thank you. See there, Maria?
Yellow fat.
Yellow fat, right? That's incredible. Bloodless, oilless, fat aspirate, that's gonna go into her buttocks, right? So
Right.
there's many things that go into getting these things. Good morning, Dr. Patino here at the Cosmetic Surgical Center of Osarito. So we're doing ultrasound guided gluteal fat transfer. So I'm looking at the patient. I'm looking at the bloodless, oilless fat graft here that's going in to her buttocks. It's incredible. And I'm looking at the ultrasound. So we're doing it under ultrasound guidance here. According to the guidelines of the World Association of Gluteal Surgeons, we're putting this in the deep subcutaneous space where it belongs. And but what is impressive here is the complete absence of bleeding. This is incredible. This is the fat graft that we got, and this is what we're putting in. It hasn't been processed in any way. This is just an incredible fat graft, and of course the fat graft survival is going to be greater, right? Why? And we do 100 here, and then I'm going to move to the other side and do 100. So the fat quality is similar from buttock to buttock. And another thing that is very important for those doctors watching out there, this is a dangerous technique, especially if you don't do it with the ultrasound, to move like this, okay? Because you're going right into the gluteal vessels. But if you do it under ultrasound, it's okay. But it's better to move to the other side, take your time, because the cannula tends to go deeper when you're in this position. Thank you.
All right, we're doing ultrasound guided gluteal fat transfer. This is the patient's skin. This is the superficial gluteal fascia. Way down here is the deep gluteal fascia. And in between we have Dr. Patino's cannula. This is the cannula, this is the point. So what we're gonna see is a gray cloud come in here when doctor gives a bolus of fat.
And I'm gonna wiggle it for you. That's the tip of the cannula. 1, 2, 3, go.
See the cloud? So we have that cloud coming in and fat is occupying this space.
And I inject retrograde. In other words, as I grow back is when I inject. Thank you.